Elevate your bodywork career with Anatomy Train's Structural Integration Certification, ATSI. Discover how to map the pattern and shape the change through inspiring lectures, hands-on body reading, and practical techniques you can use in your practice right away. Join us for ATSI Maine 2026 to 2027, where Tom Myers will personally kick off this transformative professional training. Learn more at anatomytrains.com/ATSI. At Heights Retreats, massage therapists build stable and meaningful careers rooted in wellness and care. A place where therapists are dedicated to delivering exceptional care to the guests, not to filling their schedule. Heights Retreats care deeply about their therapists, our profession, and wellness itself. Grow with Heights as they evolve into a wellness-driven future. Visit heightswellnessretreat.com for more information.
Dear listeners, we're in for a treat today. Every now and then I will get a letter from someone who is living with a condition, and they wish that they could find a massage therapist who would be willing to work with them. I have that to share with you today from an acquaintance who was a massage therapist until some things happened in her life that made that no longer possible. And she lives with a condition called Functional Neurological Disorder. So she reached out to me on my Facebook page to say, what are we teaching people about FND? Because I can't find a massage therapist who will work with me. And I took that to heart and managed to have a couple of conversations. One of them just a few minutes ago, because we have actually already recorded this podcast, except that I forgot to hit record. So we are here for a second time through with my acquaintance and now friend, Sarah Trube, who lives in Lafayette, Indiana, and has some information to share with us about FND. And actually, Sarah, I think this time what I'll do is I'll kind of lay out FND a little bit just in terms of what we understand about it. And then you can maybe fill us in with your experiences with this. FND, Functional Neurological Disorder. What you can get from that title is it's a neurological disorder, but it's purely function-based. It is not structural-based. So for instance, with something like Alzheimer's, we would see plaque and degenerated neurons. With something like Parkinson's, we'd see the destruction of the substantia nigra. With something like MS, we would see a different kind of plaque that's interfering in nerve transmission. None of those things are present in FND. In FND, the structure of the central nervous system is perfection, at least, given our current abilities to image that, but the function isn't functioning. And this can lead to a variety of symptoms, fatigue and tremor and problems with gait. The sort of giveaway symptom for functional neurological disorder are very particular kinds of seizures. These are not seizures that fall in the category of electrical lightning storms that we see with epilepsy and other seizure disorders. These seizures are poorly understood. They're called either functional or dissociative seizures. They might not be super obvious to the observer, but they can involve tremor and twitching and dystonia. And maybe you can tell us a little bit more about your experience with seizures as well. The thing is, when a massage therapist hears the word seizure, it feels like a red flag, as it should be. We want to be conservative and careful. When a massage therapist hears a word like paralysis, because this was one of the consequences that Sarah has gone through, that feels like a red flag. And so it's really easy and safe. It is absolutely the safest choice to say, I don't have the skills, I can't work with you. But, I keep saying this, the very, very safest massage we can ever do is the one that we don't do, right? The only way to make sure we never, ever run any risk is to just not do massage. That is not the most effective way to help our clients. So we're always looking for that balance between safety and effectiveness. And what you'll hear with Sarah's story is there are ways to establish safety so that we can get to a good and effective outcome with body work for her, with the right kinds of, question asking. So with that little bit of background on functional neurological disorder, which used to be called conversion disorder for stupid reasons that we might get to later, I will ask Sarah. Sarah, can you give us a little bit of your background? First, talk about your life as a massage therapist, and then we'll get into your history with how symptoms developed for you.
Well, my journey started with my mom. My mom used to give me massages every day. I suffered from headaches and migraines due to being misdiagnosed with ADD, ADHD. So I was on Adderall for about 5 years. I
And
started,
developed terrible, debilitating headaches and seizures related to the Adderall.
yeah, met a wonderful neurologist who took some time. He made me do all the tests and figured that I had partial complex seizures and that I would outgrow it. And he was the one that recommended that I get a professional massage. Little did I know that he was hiring interns from my future school, medical massage school. There were two like satellite schools, and I went to one, and I just really needed to focus on massage and heal from all the trauma. Now that I've been in the career for almost 20 years, give or take. So I graduated. It took me about 3 years to complete because of obvious, head trauma.
Okay, so you've gotten through school, you've started your practice.
Yep, owned my own business. I was told, I had a disability and
Well, it sounds like from the story that we've been through, when it really came to a head was when you hit your head. So you had a fall.
zoom forward to 2023. I started falling. I thought it was COVID, long
Right.
COVID, and then that ventured into psychiatric medications, which you can find out more on my YouTube podcast, and all my theories on that. And then I thought I was having a mental health crisis. I admitted myself to inpatient, and so me being allergic to psychiatric medications, which I found out back in 2018, they stripped me off of something too quickly and put me on new medication that I was hypersensitive to.
Which turns out, you told me, is quite common in people who have FND, right? That
Yeah.
micro doses work better than standard
Yeah.
doses.
Or none at all.
Or none at all. Yeah.
I'm allergic to about 42 out of the 65 medications,
Mhm.
and they also use generic seizure medications for mood disorder medications.
That happens. And for some people it works great, and for other people not so much. And we know that anti-seizure medications are specifically not recommended for people who have FND.
They call it non-epileptic seizures, or we're trying to refrain from pseudo or psychiatric, steering away from that, because that can manifest into physical FND.
Well,
So
and there's a tendency. I I'm going to go off on a little tangent here. So here's a condition that affects mostly women, and it already a population that is underrepresented in being the subject of research. understood in terms of understanding pain meds, right? Women are just, it is a truth. It is just a fact that women don't get the same kind of attention and care about pain management compared to males. And now we have this condition that has a history of being called conversion disorder because we are converting stress into physical symptoms. Like, it's all in your head, lady. Just go home and, relax. And that's an attitude that is not entirely gone, right? And then you can be accused of drug seeking because of the chronic pain.
I've heard it all.
It's a little bit like the history of fibromyalgia. If any of our people like me have been around long enough to watch how fibromyalgia has been treated by the medical community over the decades, now it's a thing and we understand it better. And there's some treatment options that work. And it's, there are some possible outcomes. FND is still so hazy, so foggy and mysterious. And it is easy to assume that people are faking it.
There is a lot of pain in this, and I feel like there is fibromyalgia is one of the symptoms of this disorder.
It's pain that goes along with anxiety and depression. And if you can't take meds that help you to manage the depression, it's really hard for anything else to work. So talk to us a little bit about your pain. Where is it? What makes it worse? What tends to make it better?
A lot of standing, a lot of walking makes it worse. It can make me feel like drunk out malaise on steroids. Like I have to sleep for like 23 hours. I have to go to the bathroom, make sure I get something to eat, and then no TV, no nothing. And then seizures, it can cause me to, I'll start, twitching with my face. That's the first sign that I'm in trouble. I've had people think that that was like tardive dyskinesia as well. So yeah, my pain level on the 0 to 10, which I typically use the McGill pain scale. It used to be like a 3, 4 pain before F&D. And now on that scale, it can be a 6, 5, 6, 7, or.
And so you are now, you're not able to do massage.
Right. And I go back and forth, and I try to see if I'm ready. And I made all the agency and autonomy to see if I'm ready or not. So it's just crucial that I just focus on myself and take an initiative. Okay, am I ready yet? Am I ready yet? But
so I want to point out a really interesting paradox. One of the things I've learned about FND is that one of the ways it can really sort of knock the feet out from under us is through all the fatigue and the mental fogginess and the word loss and all those things, really take away someone's sense of self-efficacy and someone's sense of drive and ability to move in the world. And, being you are on disability at this point, right?
yeah.
And we'll talk more about that in I just want to sort of reflect a little bit about what you've done with your life. But what is astonishing to me, Sarah, is that in the midst of all of this challenge, you have taken that on in a proactive way that I think the vast majority of people could not even think about doing, because you have created this website, liveinlifewithfnd.com. You talked about your podcasts and your YouTube channel. You have a literally debilitating condition that makes it very hard to be communicative. And you have become a communicator to the public about this. To the extent where you reached me and said, can we do a better job, please, of teaching people about FND?
Yeah.
So, I'm here to support you in this, but I just want to express my admiration for your ability to do this, because that sense of self-efficacy, that sense of being able to even if you're sleeping 23 hours a day, find a through line that keeps you moving forward and growing Gosh, that's huge. That is an enormous thing. And I mentioned earlier, I've done other interviews with people who live with chronic pain. And one of the things that they talk about is how much they grieve the life they thought they were going to have.
I've
But
gone from crawling, literally, to not being able to access transportation in my community very well. And I just, neuroplasticity, I'm being a medical massage therapist, you are so in tune with your body, first of all, and those around you. And so I feel like I can feel that neuroplasticity just like growing, it's amazing when you feel that every once in a while. So I go from crawling, relying on, people to, wipe me and take me to the bathroom and shower me to, now I'm like transitioning. And transitioning has been my number one thing throughout this, hence the dragonfly there, which signifies, transformation.
so I just want to point out for our listeners who are not watching the video, Sarah is coming from her, I'm guessing your office or your room,
Yeah.
in which the walls are covered with these beautiful paintings, which is part of your therapy, including this spectacular dragonfly in a night sky flying over. It looks like a white rose. It is fantastic, and I would 100% adopt that as a as a figure for transformation or transfiguration, if you like. Yeah.
Yeah. It's amazing how far I've come into almost 3 years. I've been dealing with this, and gotta say that it's taken me all this time to, reach out to you and get back into massage and in some fashion, and I know that you guys out there, will reach out and help me. And, my biggest dream is to make a foundation for a F&D specialized clinic because my town here in Purdue town or Lafayette, Indiana, is small but big enough that there's a lot of businesses and there's a lot of growth here in Lafayette.
And with the university, you can, there's a lot of educators and educated people.
Yeah, and then we've got a community college that has lost their massage department. So if we can get that reestablished, that would be fantastic.
That would be really good. So, Sarah, with the first time we made this recording, I finished with this question that just made you light up. So the reason that Sarah reached out to me is that she couldn't find a massage therapist. They were too scared.
Yeah.
Because they felt like they couldn't make an informed decision. And I appreciate that. I think we should make informed decisions. But part of that means being, knowing how to look stuff up, even if it's not in your textbook, and establishing risks and benefits. Because we've established that Sarah, she has some symptoms that affect her sensation and her strength. She's not at risk for stroke. She doesn't have her medication levels are very low. Are you doing any meds at all at this point?
No, med free.
And that's a better fit for you. That won't be the right fit for everybody, but it's the best fit for you. And so the risks that I see of what's the worst possible thing that could happen is just giving her a terrible massage that leaves her more rattled than soothed. But if I ask you, Sarah, what's the best, if you could imagine the very best possible massage for you, what would that look like?
Yeah, just looking if I could go back to my old self, feel like my old self again.
So feeling more focused, feeling maybe more energetic,
Less lonely.
less lonely. Oh yeah, that sense of connection, because you are all on your own in this, aren't you?
Yeah, I've been deprived of the human touch. And I think it messes with your psyche. I could do all the mental health therapy in this world, and it would not be conducive.
Without some kind of touch-based
Yeah.
welcome to educated touch. This is a little bit of a call out to me to, be an advocate for education for massage therapists about FND, but also maybe for therapists in your area around Lafayette, Indiana, to see if maybe they want to come and gather some data about what massage might be able to do for your mental fogginess or your pain levels or your sense of energy. Be a simple way to gather some good information to share with others. And I just love the work that you're doing in spite of, the work that you're doing to me feels even more valuable because it's in spite of your situation. You have so many things stacked up against you and you're doing it anyway. And I have so much admiration for that. Thank you so much, Sarah, for reaching out to me.
You're welcome.
Precision Neuromuscular Therapy has been teaching high-quality seminars for over 20 years across the country. Founded by Doug Nelson, PNMT uses problem-solving skills and precise treatment options to get powerful results for your clients. PNMT seminars focus on honing your assessment and palpation skills to precisely target the source of your client's pain while understanding the why behind the what. Meet us in a hands-on seminar or online in the PNMT portal and let us join you on your learning journey. Learn more at pnmt.org.